to make sure that health care is spread to everybody. It's not a different nation. It's continuing the best in our nation.
Republicans can't repeal the Affordable Care Act. They're going to try and rot it from the inside.
You know, this Obamacare, it works pretty well.
Well, so much for that. Those same three House Democrats, major supporters of the health care law, now calling for a major change. They want to delay the tax penalty on uninsured folks who haven't signed up. To Hadley Heath Manning, who says they can't have it both ways, and Jessica Ehrlich, who disagrees. First, to Hadley, why are these Democrats doing this right now?
Well, Stuart, they'll say this is about financial relief for their taxpayers who will face a penalty under Obamacare, but ultimately, I believe this is about political cover. These are lawmakers who've supported Obamacare, and they know that their constituents will blame them when the tax bill comes due. And
what say you, Jessica?
I disagree. I mean, this is actually something that happened because the expiration date just occurred on February 15th. These are members of the House in particular, and in the Senate actually, who deal with Ways and Means and with tax issues, and they have concerns because some people have been confused. There's been polling that's been done thinking that they had until the actual tax date of April 15th in order to make sure that they're covered. So they said back in December that we should do just a special little short-term coverage here to make sure that people are aware that if they are required to be covered and they aren't, that they can get the coverage they need and they're not suffering another year of penalties.
So what do you think should happen now, Hadley?
Well, speaking of suffering, it hurts to be put between a rock and a hard place, choosing between buying overpriced insurance products and paying a penalty for not doing so. So I think lawmakers at this point should focus on going back to the drawing board with health reform, focus on making health insurance a product that's both desirable and affordable. If it's those two things, you don't have to mandate that people buy it.
You know, Jessica, I just saw a study that shows that these bronze plans, which are supposed to be the cheapest, they carry deductibles 5 times higher than the deductibles on an employer pension, health plan, for example. You can't blame people for not wanting to sign up for that and for, you know, taking the risk of a fine from the IRS when they're facing huge deductibles.
Well, there are certainly people, I think, who may just take the fine. I mean, unfortunately, hopefully that won't be the case. The idea is
but isn't that a
the
rotten
more
position
people
to be
that are
putting them
actually
in?
covered.
Wait a minute, isn't that a rotten position to be putting them in the first place?
Well, it's a rotten position to not have health care and to become ill and have to go to a hospital, and then all of the costs from people who are uncovered gets passed on to everyone else. So it's a rock and a hard place for everyone here in terms of trying to fix what is definitely, and I think acknowledged by everyone, a broken health care system. But the concern right now is the people who just aren't aware.
Is this a broken health care law?
Exactly. I mean, we had a broken system before 2010, and now 5 years later, after spending millions of taxpayer dollars on advertising, trying to get people to sign up, recruiting the NFL and Hollywood celebrities to advertise this law, we're still not at a place where Americans understand it. It's simply too costly and too complex.
Jessica, I have to ask you about that strange video that I saw last week. President Obama, I'm sorry to say, clowning around to try to get sign up for Obamacare. Was that a mistake?
They've done lots of different videos and various things, and you know, this is a president who likes to really get out there and do things. He's younger and be sort of more modern and in touch with people. So you know, that's just the way that he approaches.
But when you saw it, Jessica, when you saw it, were you a little shocked? The President of the United States standing in front of a mirror, putting his tongue out, making faces. Was that just a little off-putting for you?
I don't know that I wasn't really shocked. I mean, I maybe at this point, no. But I mean, you know, it's one of those things a lot of times where, you know, and if you're getting people to go and see doctors, people do all sorts of different things in order to encourage them to go. So, I mean, I think that's more of a personal choice, or maybe a choice that's made amongst his staff that's separate from the issue of the implementation of the law, which is really something that has to do. I mean, we went through this with Medicare when they did the drug implementation, and everyone was in the donut hole in Part D, and it was very confusing and difficult, and eventually we got through that, and hopefully that's what will happen here, is if we have this short-term fix, let people get, you know, the coverage they need so that they're not having tax consequences, and so that the IRS doesn't, you know, implode itself trying to deal with all of this.
All right, Jessica, Hadley, both of you, thank you very much indeed. Appreciate you being with us.
Thank you.
Thanks.
Greta says, give me a break.